This is Governor Steve Beshear about Kentucky. When I became governor in 2007, the mood was grim. Kentuckians had lost faith in their government, and a global recession was threatening our jobs, our homes, and our health care. Today, thanks to hard work and collaboration, Kentucky's economy is setting records, and our government is again focused on taking care of its people. One area in which we've made significant improvements is protection and safety, one of the government's most basic responsibilities. We all know that Kentucky's challenges were steep and stubborn, and they included things like soaring substance abuse and addiction, the nation's fastest growing incarceration rate, rising numbers of juveniles detained out of home, and woefully outdated public safety facilities. We had little money to attack these challenges, but through innovative strategies and bold initiatives, we were able to make tangible progress. One of the biggest areas was substance abuse. It's one of the most damaging public health and safety issues that we face, made even more stubborn by the rapidly changing nature of abuse. The number of Kentuckians who die from drug overdoses, for example, has steadily climbed to more than 1,000 each year. This has not only caused unlimited suffering for our families and communities, but also has exacted a huge toll on our social services, workforce, economic stability, and growth. We've worked across party lines, however, to target methamphetamine, prescription drug abuse, synthetic drugs, and most recently, heroin. And we've done so with multifaceted strategies. We've invested in treatment and education, opening nearly 1,400 new beds through Recovery Kentucky and other treatment centers. We've trained prescribers to recognize abuse and change their habits. We've closed the doors on unscrupulous pill mills. We've worked with communities to collect and dispose of unneeded medications. And we've given law enforcement more tools to respond to emerging substance abuse issues. The result has been a significant decline in prescriptions for the most commonly abused medications, a reduction of 50% in what's called doctor shopping, and more Kentuckians seeking treatment for addiction. We took a similar approach to our growing prison population. Working with legislative, judicial, local, and private partners, we identified substance abuse as either the primary or secondary cause of more than 70% of offenses. So we modernized our drug laws, put a bigger focus on treatment, and developed programs to keep offenders who leave prison from returning. Since then, we booked almost $56 million in savings that we would have spent on incarceration. We've also reduced our prison population, especially the number of minimum custody inmates, allowing us to eliminate private prison contracts and close a state prison. And then in one of the most creative recycling projects in Kentucky's history, we turned that prison into a desperately needed modern training facility for the Kentucky State Police. Likewise, we converted a former state psychiatric hospital into a state-of-the-art facility for our medical examiner. Talk about thinking outside the box. And finally, in the area of juvenile justice, we've revamped the system to steer more young offenders into community-based treatment rather than locking them up in detention centers. As far as other safety initiatives, we've extended needed protections to dating partners. We've channeled more money into the state's Internet Crimes Against Children's Task Force, and we've placed social workers in our public defender offices. These initiatives wouldn't have been possible without the support of legislators, local officials, and community leaders. I'm proud that by working together, we have made Kentucky safer and more responsive than it was 8 years ago. This is Steve Beshear. Thank you for allowing me to serve as your governor.